Bethany TV for health. Are you ready for this good news? You can now watch Bethany TV on your TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health. Bethany TV for health.
And our topic, as you can see, it's basic of menstruation, and that is none other than Dr. Gozanga Underbat. He's a specialist in IVF, laparoscopic, and fertility-related issues. I'm Teacher Zita. Welcome to the show. As we shall explain to you more about menstruation, you want to know about beads, you want to know about all the cramps, you want to know about everything about your body, you're in the right place. Let's get started. Welcome to the show. Welcome once again. I'm Teacher Zita, and we are very privileged to be with you today. This is Medical Minds, and this is our very first production. Now, as I told you earlier on in our intro, this show is all about well-being. It's all about our health. It's all about knowing our body. Now, in today's show, we have a specialist and a doctor who is going to say hello to you and tell you more about whatever that we are going to talk about. Is Dr. Gozanga Underbat. He's a specialist in IVF, laparoscopic, and fertility issues. Hello, doctor.
Thank you. Hello.
Good evening.
Good evening.
Welcome to the show. I'm okay.
Thank you.
How was your Sunday today?
Oh, relaxing.
That's very good.
Yes.
Doctor, you're welcome to our very first production.
Okay.
This is Medical Minds, and we're looking at basics of menstruation. Yes, everybody, I'm sure people are watching and they want to know what menstruation is all about, because sometimes we go through these experiences, but we can't explain, we can't know. We just don't know. We see things going on as women, we see it coming and going, but when we don't know exactly what it's all about. So in your own experience as a medical expert, can you kindly explain to us what menstruation is all about?
Yeah, good evening, viewers. This particular topic is actually very, very key. As he said, as the Teacher Zita said, I'm called Dr. Andabati, and I'm a gynecologist, a fertility specialist, but I'm also a reproductive endocrinologist.
Okay.
And I also do a lot of keyhole surgery.
Okay.
But all this to help women. About menstruation, menstruation, I think we are all aware, what is happening is there is an outflow of blood from the reproductive system of the woman, and it happens every month. So today we are going to go to the basics, simple basics on what is going on and what the menstruation, where it is coming from, what is causing it, how can you use that knowledge Yes, so that you can understand ourselves really.
Okay.
The women can understand themselves.
Thank you so much,
Yes.
Doctor. Let's go straight away to our discussions. Can you briefly tell us the entire cycle, the key stages involved during menstruation? Where does it start from? By that time, how is the body relating? How are you reacting as a woman? How are you feeling? Yes, those stages, we would love to hear them from you.
Yes, so now menstruation, as I'd said, is seen as an outflow of blood,
Okay.
which is coming from the woman's womb, what is called nabana. So inside the woman's womb there is a lining of skin, a thin soft lining,
Okay.
which sets off every month. Now it is behaving like that in response to the hormone changes in the woman's body. And these hormone changes are cyclic, that is, they keep one following after the other, and then the outshowing sign is the menstruation. Because it is a cycle, for better understanding, we usually divide it into about 3 parts.
Okay.
So the first part is the menstrual period itself. Now the first day of the cycle the period is referred to as day 1 of the cycle, and that is the first phase. It's the menstrual phase. There is an outflow of blood, and that is the main thing you get to know.
Okay.
Yes, but then it also extends into another phase, because ideally what the body is doing is the body is going through cycles, but it is preparing to get a pregnancy. Yes, so it sweeps out the old lining and prepares an egg, and then that egg gets ready and it is released from the ovary, waiting for a pregnancy to come.
Okay.
So the first phase is to sweep out, that is the menstrual phase. The second phase, what we call the follicular phase of the ovary, is for the egg to grow. And once the egg is ready, the egg is released. And that's the time when the woman gets a lot of sticky secretions, her desire for the man increases.
That is after the first phase, after menstruation.
Yes.
Okay.
Yeah, and then usually it's followed by the follicular phase, which lasts for about 5 to 7 days.
Is that what we call safe days?
So I'll come to the safe days in relation to these phases.
Okay.
So from menstrual phase, we go to the follicular phase, and then it's followed by 1-2 days of ovulation, and then after that you go to what we call secretory or ovulatory phase. That is ideally the time when a pregnancy is supposed to be already or taking place. And then if nothing happens, you go back to the menstruation.
So what happens when that egg is not fertilized?
So if that egg is not fertilized, then it gets absorbed. It dies and it gets absorbed by the body, because these are cells of your body and they are not harmful to you at all.
Okay.
Yes.
Thank you.
Yes.
So those are the key stages.
Yes.
Okay. What are the hormonal changes that happens when a lady is going through menstruation in the body, the hormonal changes in the body?
Yeah, so this cycle which we have described related to the womb is being controlled by the hormones which are produced by the ovaries.
Yes.
Yes, the ovaries produce the hormones. I think we may need to have a diagram
an
for
illustration,
this.
so that someone can understand it better.
Especially, yes, so the diagram, as can be seen. Yes, so what we are really talking about is down here, this is the womb, the uterus, okay?
Okay.
And this is the lining I was talking about that sets off.
That is the shading that dissolves into the blood.
Yes, that comes out here as the blood flow.
Okay.
Then right here we have the ovaries.
Okay.
Yes. So the ovaries produce hormones, and these hormones go in the blood and they reach the womb to prepare the womb after it has already set off the previous lining. And as the hormones are preparing the womb, some egg for that month is growing. Yeah. And so this egg, by around day 14 of the whole entire cycle, the egg is ready and is released and is picked up here and is supposed to meet the sperm, and then a pregnancy occurs. Now, if the pregnancy does not occur, for example, it doesn't meet a sperm, then the body, the egg dies, and the body absorbs.
Okay.
And the body notices that actually nothing has happened and this sets off again.
It sheds off through blood again.
Yes, so you go through the same
cycle
over and over like that.
Okay, doctor, before you sit,
yes,
do all these ovaries release eggs at the same time, or one releases? Is there a timetable?
There's a lot of democracy inside here, and it is very interesting to note that these ovaries, they keep on taking turns. Yes, most times one follows the other, but not very strictly, because we now know that ovulation occurs more frequently from the right side than from the left.
Okay.
Yes, but that doesn't really usually matter because it's just the egg release and it can be picked.
Okay.
Yes.
Thank you so much, doctor.
Yeah.
Now, the next thing is when the body is going through this entire menstrual cycle.
Yes.
Are there some, for example, what causes women or mothers to be so moody during that time? Sometimes I find the mothers so moody, especially when they're in their periods. The mood changes.
Yes.
Is there any effect onto the
what is causing that? Yes. So as I told you that the womb here is responding to the hormones which are being produced by the ovary. Now the levels of there are two principal hormones we talk about usually: the estrogen and the progesterone. Now, the estrogen is the female hormone.
Okay.
When you hear estrogen, is really the female hormone. I think most people know this. Okay. Now, the level of that hormone keeps on going up and down. When it is up, the woman is really a woman. Yeah? She really has desire for the man. She has the shiny skin. There's even a typical smell she can be having when the hormones are very high.
Okay.
But when the estrogen goes to the bottom, just like what happens when the menstruation is coming, her moods change. Her desire for the husband drops down. Even her relationship with the other people, drops down. This is really by design. So it's because of the low levels of the estrogen during the menstrual period. When the menstrual period is even just approaching, the hormones already drop.
Does that explain the reason as to why by that time a woman doesn't want to get close to the husband?
Oh yes. For some of them, the change is so much so that they even hate the other words which they later regret. And so it happens. Yes.
Thank you so much, doctor. For all the fathers and husbands watching there, I think you can know where our moods come from. At times you don't know why, and you keep saying, Mama good, so and so, something like that. We also don't know that such things happen with our bodies. I'm glad that, doctor, you've explained it very well. Thanks so much for that illustration.
Thank you.
Now, doctor, some periods are regular. Some periods are regular in some ladies, some are not. What causes that? Yes.
So some periods for sure are regular, others. Normal period is supposed to be regular. When we talk about the regularity of a period, we actually mean that it's predictable. If it's happening, for example, we're talking about the interval between the beginning of the periods. If the interval is 30 days, it should be 30 days for that person. If it is 28 days, it should be 28 days. It shouldn't fluctuate between 20 days, then another time 30 days, other times 36 days. That is irregular periods. Yes.
And that is very common in many ladies.
Yeah, so actually it is not very common, except that people try to relate their period cycles to the month, which is different. Because if somebody's cycle is, let's say, 28 days, that means every 28 days is getting a new period. You may find some months he gets 2 periods in 1 month, 1 calendar month. And then some months he gets 1. Then he gets concerned, like, in October I got period once. But now in November I'm getting period twice.
Yes.
But what is important is the interval between the beginning of the period.
The beginning of the period.
Yeah, so periods, most people actually have regular periods unless if they have some issues.
Those are hormonal issues too?
Yes, so periods are controlled by the hormones. The estrogen and the progesterone from the ovary. Okay. But again, the ovary is under the control of the brain.
Okay.
Yes. So the brain is the one which sets the pace, the pace at which the periods are coming. There's a part of the brain called pituitary and hypothalamus, which regulate how regular you get your period.
Okay.
Yeah, so of course, there are certain people who have irregular periods, and that is a disease condition. It may be associated with not having ovulation, and that can translate into infertility.
Okay.
So that's why we usually advise, even though we know that some of the things which people describe as irregular periods are actually regular periods which are mistaken. We don't want them to take that decision. They should go to a health worker who has the knowledge to decipher this out and see, yeah, your period is actually normal, or yours is not normal, and then you can find a solution to it.
Thank you so much,
Yes.
Doctor. I was talking to a lady sometimes back, and
Yes.
she was telling me sometimes she has periods for a whole week, and then other months she can have it like for only 3 days. How can you explain that? Is it still the same hormone imbalance?
So there are certain key characteristics of the periods. We've talked about regularity, the interval between the beginning of the periods, but also the periods must be, when they are on, they must be for a certain length of days. Normally between 2 to 5 days.
Okay.
Sorry, it shouldn't be more than that.
Okay.
And once it is, for somebody, if it is like 3 days, it should be almost 3 days all the time.
Okay.
It should not be changing drastically.
Okay.
So if there are those fluctuations, then it is of concern. And periods more than 7 days are of concern,
Really?
because they may be related to some disease conditions.
Okay.
Commonest are the fibroids.
Even if a girl is young, it can be related to that?
Well, no, maybe not. But for a younger person, those are usually hormone related.
Okay.
For the younger people.
Okay.
Yes.
Doctor, how about mothers who tend to miss out their periods? Is it still, we are still looking at regularity and irregular. Someone can miss out their periods like twice a month. They don't see anything.
For 2 months, they
2
don't
months,
see
there is nothing, yes.
Oh, yeah.
But they have severe pain during that time when the flow is, when there's no flow.
Yeah, so missing periods 2 consecutive months is a concern.
Okay.
It has to be evaluated, because as we said, period is an interplay between the hormones and the womb. So if somebody is missing periods, it could be the problem is with the hormones, or the problem is with her womb. And for the ones where the problem is with the womb, you know, some people have the lining of the womb has been destroyed by diseases, either infections, or they have undergone some surgical procedure, major surgical procedure on their womb, which destroyed the lining of the womb. And so in such a case, they will not see their periods, or if the period is there, it will be so scanty. And then there are people who have hormone issues, and again, they don't see their period. So that has to be evaluated. If you miss your period for more than 2 months, you have to be evaluated for an explanation.
Okay.
Yeah.
Thanks so much, Doctor. I think for all our mothers who are watching us, we are still talking about basics of menstruation, and this is Medical Mind. I'm hosting Dr. Underbat, and he's taking us through our body. We are learning a lot about menstruation today. Doctor, our next inquiry is about underlying health conditions that could cause irregularity, maybe, yes, in periods, diseases or things that can cause.
Yeah.
Yes, that can cause us to miss, yes.
Yeah, so in the field of reproductive health, analyzing the period is a very key concept. The period is one of the first things the gynecologist wants to know about in reproductive health. It is a very key indicator of reproductive health.
Okay.
So if the periods have irregularities, either the periods are irregular, or they are painful, or they are too heavy, there are usually certain conditions which are related to that. For example, heavy periods, meaning that the periods are for a longer period of time, and they are more than
the flow is
heavier.
Heavy, yes.
Yes, such are usually related to fibroids, or they
even in younger girls.
No, then for the others in whom there are no fibroids, there could be other hormone issues. Even thyroid issues do present with heavy periods, especially hypothyroidism. Low functioning of the thyroid gland can be associated with heavy periods.
Okay.
Yes, and sometimes some people without their notice, they do use some hormone-containing creams. It can disorganize their periods. And we've seen this beginning to show up. People who use lightening cream, some of those creams do have hormones in them, and it can disorganize
So they
them.
go as far as affecting the internal.
Yes, the internal system, it disorganizes the hormone balance of the body, and then that shows out as a disorganization of the period as well. Yes.
Wow.
So
that is very interesting. Doctor, how does menstruation play a role in working with the uterine line to prepare someone for pregnancy? Yes.
Yeah. So the body is very smart, and like any other creation by God.
It's like a network.
Yes.
This connects to the other?
Yeah, it's quite coordinated. So what happens is, as we described the phases of the reproductive cycle or the menstrual cycle, the first thing is the body noticed that there was no pregnancy in the previous cycle. The body first sweeps out the lining.
Okay.
And by lowering the hormones, it sweeps out the lining. Then that is followed by rising of the hormones, and these are the estrogen hormones from the ovary, alongside the growth of the eggs. So as the hormones are rising to prepare the lining of the womb, the eggs are growing for that month. Yes. So by the time the egg is released by the ovary, the lining of the womb is ready. The land is ready for the baby to attach.
Okay.
So in case fertilization occurs, the egg is released and the fertilization occurs, then the baby has straight away to attach to the womb inside. And then if that happens, pregnancy has occurred. But in case that does not occur, the body again senses that no, pregnancy has not occurred, so let's remove the lining of the womb again, preparing for the next phase. Okay. So all these things are balanced. Preparation of the womb is linked to the growth of the eggs in the ovary. Okay. So this is how it is done by the body.
Okay.
Yes.
Thanks so much.
Yeah.
Doctor, when you have intercourse during menstruation,
yes,
are there chances that you might conceive?
Chances are, if it is true menstrual flow, chance will be very low. Chance will be very low because, as you can understand from the science, this is the time when there is no mature egg. So the sperm will not be able to have anything to fertilize to start with. Okay. And also, secondly, the flow of the blood is so heavy that it cannot allow any attachment of any embryos. Okay. Yes. And this is the time when the lining of the womb is not ready. It has just been swept out. So if it is true menstruation, I emphasize true menstruation. If it's true menstruation, there should be no pregnancy, really. Okay. But there are those, what we call false menstruations.
Well, what are those?
False menstruations occur usually around the time of ovulation. Yes. They are not true flows, they are usually spotting.
Just some drops?
Yes, because again, because of the hormone shift at the time of ovulation, there's a slight hormone shift from estrogen to progesterone at that time, and that change, the body may notice it and can mistake it and can cause a little bit of spotting in the transition. But this is not dangerous. It corrects itself quickly, and usually is fine.
Thank you.
Yes, that's one. And the another one is sometimes, as the embryo is already formed, the baby has to enter the wall of the womb. It's like a jig, it has to enter inside. Sometimes that is traumatic and it can cause spotting. We call implantation bleed. Okay. Yeah, so those are the two false menstruations, during which if you have intercourse, actually you can get a pregnancy. Oh, yeah.
Thank you so much. Doctor, let's talk about ovulation. You've been mentioning it, ovulation. Yes. What exactly is ovulation?
Yes, so again, as we described the phases, we talked about the flow of the period. Now that marks the beginning of the cycle usually, and that is the time when the egg that is destined to be released during that month is beginning to grow in the ovary. It starts growing and growing and growing. It takes about 14 days and it matures. Now once it matures, it has to be released from the ovary so that the tube can pick it. Yeah. Now that process by
preparing it for fertilization?
Yes, so the process of the release of the egg is called ovulation.
Okay.
Yes.
Thank you. Thank you. I think we've now got it and understood it better. Thanks so much, Doctor. In case you've just joined us, this is Bethany TV, and we are talking about basics of menstruation. And this is Dr. Gonzaga is trying to explain to us what takes place in the body of a lady or a mother or a woman each and every month. Though at times it is very inconveniencing, but we have nothing to do. It's a part of life, and that is how we can always go by it. Doctor, how can you track and manage your menstruation very, very well? For example, if we're going to use beads, something like that. It's called a moon bead?
The moon bead.
How can you track that now my menstruation is about? Because sometimes a girl conceives or a lady conceives when they are unaware that they were about to conceive or their menstruation is due. How can you help us to track our own menstruation flow?
Yeah, that's a very interesting question, Jita, and it's I want to use this week's opportunity to explain it very well. So you talked about ovulation. Before I go into the other explanation, ovulation is actually a painful event. You can actually feel the pain of ovulation. That's one of the signs that somebody is ovulating. Now, how to track your menstrual cycle or understand it?
Yes.
Now, there are different aids. One, you have to have the basic knowledge which we have explained to you, but there are different aids. One of them is the moon bead, which is very cheap and should be available actually. Very
many few, actually we are, including me, I don't know how to use it. I've never, I see it in pictures, chats, but...
Yes, so we also have, we do have the apps. There are now some apps which are available, which you can use them, or you can use the chart to track. So if you can use the chart to explain how to understand your things, so let's use the chart instead. The chart, the round chart, the menstrual cycle chart. Let's have it. Menstrual cycle chart. The menstrual cycle chart.
Yeah, is this
oh
one?
Yes, this one. Okay, yeah, this actually explains it so well. So the first day of your period is regarded as day one of your cycle. Yes. So you go through the periods per day, and like this. Usually for about
the 7th day.
Yeah, this is a bit of longer, but usually about 5 days. Okay.
Okay.
So this marks the end of your period. That's the flow.
Okay.
Here it might be light for the next 2 days.
Okay.
Now, around here is really when the egg is almost getting mature. Okay. Okay.
Yes.
Now, when the egg matures, the egg gets released. Okay.
Okay.
Usually about day 14. But it could happen day 13, could happen day 15, okay?
So during this is when the fertility rate of a mother is high?
Yes, yes.
This green area?
Yes, so during this green zone, if somebody is trying to look for a pregnancy, this is the time period during which she's most fertile. And this will be recommended for intercourse in case he's looking for a pregnancy.
Okay.
Or this should be avoided in case he wants to avoid a pregnancy, because this same knowledge can be used to avoid a pregnancy.
So that basically takes 3 days. 3?
Yep. Usually ovulation will be 1 day, but if the woman meets with a man a day earlier, she could still get pregnant because the sperms will still be in her system by the time of ovulation.
How long does the sperm take in the system?
Well, about 72 hours for them to be functioning, but we know there are biological variations. 72 hours is about 3 days.
3 days, yes. Okay.
So sometimes you even up to here. So we usually say 1 week, a period of about 1 week around here. So we stretch this up there by 2, and we stretch here by 2 again. So 2 days before and 2 days after is the danger zone.
Okay.
Yes.
So this proliferative phase,
yes.
Is that the safe phase?
Yeah, so when we talk about now the safe phase, if somebody is using this knowledge for preventing pregnancy, now the simple idea usually is that once your period ends, assuming your period ends here, The first 7 days are safe. 1 week after your period
You
is
are
safe.
safe.
Yes.
Okay.
1 week towards your period, you are safe.
1 week after.
Yes.
Then towards.
Yes, 1 week after your period and 1 week towards your period.
Periods.
You are very safe. In between, you are not safe.
So the in between is this.
Yeah, it includes this. This is a bit precise, but on average, we usually talk about that.
Okay.
1 week after your period and 1 week before your period.
Okay.
Be
Okay.
safe.
Okay.
Yeah.
Okay. That is very illustrative, doctor. Thank
Yeah.
you so much. So that is how best a woman can track their period.
Yes.
You know, you count the 7 days, 5
Yes.
to 7 days.
Yes.
You're flowing.
Yes.
And then the next 5 days, somehow.
Next 7 days.
7 days.
You can be okay.
You can be okay.
Yes.
Then in between there, it's not safe at all.
No,
You need to abstain and
Yes.
keep safe.
Yeah.
Then you go on. After here, doctor, you didn't explain to us here?
Yes, so after the ovulation here, after ovulation,
Yes.
2 days later after ovulation, usually you will not be practically having high chance of conceiving.
Okay.
Yes, so all this period, if ovulation occurred and fertilization occurred, this is the time when the baby is attaching and pregnancy is establishing itself. So in case pregnancy occurs, then the period will not come. So you will miss the next period.
Okay.
Yeah, that's how it works.
Thank you so much, doctor.
Yes.
Thanks so much, doctor, for that illustrative explanation. In case you've just joined us, this is Medical Minds, and we are looking at menstruation, the entire system. The last explanation doctor was trying to show us is how best a woman can track their periods. It's still Bethany TV. I'm Teacher Zita, and the discussion is still on. Doctor, let's look at the relationship. Okay, I think we shall have a brief break, and then after we return, we shall look at more questions. We're going to have a very short break. When we return, please join us and be part of us. Our lines will be open just in case you want to make any call. You'll be free to talk directly to the doctor. Thank you so much for being.
Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health.
House of Music Tusako Gospel Legends Ngabiri December Hauko Imperial Real Hotel Wakuina shinze mtwaro 10 emitwaro 2 ne meza milioni 2 nebo ogula areba ticket yo ku FlexiPay ebera ya mitwaro 7 ne 15 nyiga kamunyenye 2 mwende mukadara ogabirira njagiriro tokola program endala yo Ngabiri December tangu tusinze nabayimire nyimbe ziwanga denge fudu ngazitunyumira no studio wemioyo atene wangula na award bakulembedwa mu Betty na Maganda Robert Senyonga Betty na Chibuka Joseph Segawa Betty Mwanguzi Kero Musanyusa Debbie Katende the Gospel Light Crescendo Choir no line up magita Gospel tikade kabiri Imami Bidadi Bulemoto aleko mune out tutendereze tusize Kale twana mu Gospel Legends Ngabiri December ku Imperial Hotel Esa wa 12 zo regulo Bitegekedwa House of Music
Bethany TV for health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV, for health. YoTV Super App presents the Black Friday Trolley Dash. Simply subscribe to any of the bundles. When you subscribe for a month, you have 20 chances in the draw. For a week subscription, you get 7 chances. And for a day, you get 1 chance. The winner will be getting 200,000 shillings worth of shopping at Mega Standard Supermarket throughout November. The Black Friday Trolley Dash, proudly brought to you by Mega Standard Supermarket, YoTV, and Bethany TV for health. Are you ready for this good news? You can now watch Bethany TV on YoTV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for Bethany TV.
Welcome back. Just in case you've just joined us, this is Bethany TV and it is Medical Mind. Our topic today is basics of menstruation. In case you've just joined us, we've illustrated a lot. We've talked a lot about menstruation, and that is Dr. Gozanga trying to take us through the entire experience. Well, menstruation is one of the most annoying experience that ladies, mothers, the mamas go through, but it's part and parcel. There is nothing that we can avoid from having it. Before we went for the break, we gave you quite a number of things we talked about, and we also talked about tracking our menstruation, just as Dr. illustrated it. We have our numbers in case you want to be part of the discussion. The numbers are 0786 050 762. You can WhatsApp us or you give us a call shortly after that. I repeat, 0786 050 762. Welcome back from that break. Doctor, back to you again. We are now looking at menopause.
Yes.
The relationship between menopause and menstruation.
Yes.
Yes. How are these two related to each other?
Yes. So menopause, as the name says, it's from two. Meno, that's menstruation.
Okay.
Pause.
Oh.
So there's a pause of menstruation.
Okay.
Yes, that's what menopause means.
Menopause, really.
Yes.
Okay, that's
yes.
good. Mm.
So during menopause, the woman permanently stops having her period.
Okay. Mm. And at what age does the menopause start from?
Average is about 50 years. Average is 50 years in normal circumstances, but it could come down in some people to 45 years. I've seen some people. And if it's below 40 years, then we call it premature menopause.
If it is below?
Yes, if it's below 40 years, it's called premature menopause, yes.
Is there any condition that causes that?
So if you come back to what happens in menopause, is actually that, you know, the design of the woman's reproductive life is fixed. So what happens is by the time the lady is born as a girl, she's born with the number of eggs she will use in her entire life. In her entire life? Yes, the eggs are already there, their numbers are fixed deposit. Really? Yes. Then she loses a few until she reaches puberty about 10 to 12 years of age. Now, when she starts getting her period, what is actually happening is she's, at the same time, every month she's picking from the deposit of the eggs in the ovary. Every month, just like picking something and others fall off, it also happens. So you see, you may pick like 10 to 20 eggs every month, but one matures to be used. But remember, she's not adding any new. Yes, so when this process continues, it reaches a point when the reserve is exhausted. Okay. Yeah, and when that happens, then her periods stop, because it also marks the time when the production of the hormones by the ovary also ceases as well. So the egg production stops, the hormone production also stops. So that is now
the fertility process of a woman
Yeah.
definitely stops there.
It stops by around, yes. So we see this around 45 years to 50 years of age.
Okay.
Yes. And when this happens, so we see that the period stops, but also it means that she can't get pregnant because she's no longer producing the eggs. And also her hormones production go down.
Okay.
So that is what we call a menopause.
Thank
Yes.
you. Okay.
Yeah.
Doctor, I was talking to a lady some few weeks back.
Yes.
She told me she had stopped her menstruation some 2 years. Then all of a sudden, last, I think that was around June, the periods came. And she conceived, but eventually she lost a baby. What could be causing that?
Yes, so that happens. That does happen. It's not very common, but it also can happen because we know that practically the eggs are exhausted. They're not there now.
Okay.
And then also the ovary production of the hormones goes down.
Very low.
So yes, and that's how the periods stop.
Okay.
But incidentally, in some people, some few eggs still remain there.
In the corner there?
Yes, they remain there.
Okay.
So
as a result?
yes,
Okay.
they remain there. Though they are few, and in most cases they are not normal eggs because they have some genetic damages. Yes. So for some reason they start growing up, and sometimes this reason is because the person's health improves. Yes. So if somebody has had an unhealthy life, or both physical and mental, towards the menopause, and then all of a sudden maybe they improve their life either by adapting to it, or something good happens to their life, they get excited, they are happy, the body gets well, they say, I'm okay now.
Okay.
Start speaking those remaining eggs,
Okay.
and somebody could get pregnant despite the fact that they are not seeing their periods. Yes, so this can happen, and I've seen it in a few people.
Okay.
Unfortunately, in most cases, they end up in miscarriage because the eggs are not normal. Yeah, and the body senses the genetic abnormality and it removes the pregnancy as well.
Okay, thank you. Are there some medical support that such a mother can receive to keep the baby,
Yes.
the fetus?
So, exactly. In such a case, if somebody realizes they are pregnant in that time, one of the things we do is hormone support because, as we said, the production of the hormones by the ovary also goes down. And that may be the reason why somebody gets a miscarriage. And if that is the reason, then hormone support can help.
Okay.
The only challenge is this is also the time when there's a high risk of getting abnormalities in the baby because of genetic issues. And so you are put into a dilemma whether you should support such a pregnancy and then get an abnormal baby or not.
Okay.
But it's not an absolute reason for not supporting.
Okay.
It's advisable to support if you want to keep the pregnancy, and then you can check those abnormalities later in the pregnancy and decide whatever to do.
Thank you so much.
Yeah.
In case you've just joined us, please keep on preparing your questions. The doctor is right here in the studio and is going to give us his feedback. The numbers are 0786 050 760. It's Medical Mind and it's Bethany TV. Doctor, to take you back a little, you talked of ladies phasing out their eggs each and every year. And then at a certain point, we become infertile, right?
Yes.
We fail to give birth by that time.
Yes.
Now, I just want to chip in something small. How about the men on the other side? Because you can see a man very old, 6 or 7 years old, but still giving birth. How is the magic behind it? Men don't grow old? They work throughout the years?
Yeah, so that's a very intelligent question. Very, very intelligent question. Now, initially we used to think that men remain fertile throughout their life. This is not true, actually. Now, recently we are beginning to agree among the experts in the field of endocrinology and reproductive health that actually men's reproductive potential goes down. Their ability to make a woman pregnant goes down for various reasons. Their production of sperm actually goes down. Their sperm count goes down now that we know it. Their hormones, the male hormones, go down, so their sexual drive goes down. That culminates in a lower chance of getting a pregnancy.
That is from what age?
Well, for men now, the age is not very specific, but we now know these things start setting up in around 45 years of age. In some people, it can even be as early as 40, but by and large, around 50 years.
Okay.
Yes, we start seeing them coming in, although they are gradual.
Okay.
And there's a lot of variability between men, between one man and another. So this is the reason why it took a long time to agree. Not yet completely agreed, but we are seeing it coming up. Yes, so their fertility actually drops down a bit slowly, and then it comes in after a later age. Yes, there is now what we call ADAMS, androgen deficiency in aging men. We now see that coming up. The male hormones go down, and it is being described as a syndrome. So that's why you find some of the older men, they actually get remarried not because of sexual desire. They are usually because of some social reasons. Their sexual desires usually go down after some time.
Okay.
Yeah.
Thank you so much, Doctor, for that elaborative explanation.
Yeah.
Let's look at cramps, those painful moments.
Yes.
Yes. What causes those cramps? Are they called cramps? That's the right scientific name?
Those terms all apply. Cramps or painful periods, or in medicine we call them dysmenorrhea.
Dysmenorrhea.
Yes, that's the medical term, but it's all meaning painful periods.
Okay.
Period by design has some bit of pain because sometimes you have some clots, the womb has to squeeze that clot out, so that gives some little bit of cramp. But two things. One, this should not reach a level where you must take a painkiller. If you have to do a medication to control the pain, then that is a severe pain. Or if it disrupts your normal work. Some people during their periods.
Okay, thank you so much. A caller on the line, Bethan TV, hello. Hello, caller.
Yes, hello, doctor.
Hello.
Yes, this is Khadija.
Oh,
thank you for calling, Adija. Where are you calling from?
I'm coming from Fort Portal.
Oh, thanks so much for watching Bethan TV. Please feel free, talk to the doctor.
Yes, I wanted to know, doctor.
Yes.
Some periods that I'm going to menstruation periods like 3 times a month.
Okay.
So you can tell me what is the problem. We can go into July, 15th July, 21st July in the same month, 3 times.
Thank you so much, Adija. Thanks so much for watching Bethan TV. Doctor is going to respond to you immediately.
Yeah.
Yes, Adija is saying yes.
Yes. Yeah, thank you very much for calling, Adija. You've said your periods have occurred 3 times in 1 month. That definitely is not normal. You need an evaluation. It could be something has happened within your womb, or it could be that you could be having some cysts. So you definitely need to see a gynecologist to attend to this.
Okay, so Doctor, another caller. As Doctor concludes, caller, hello. Bethany TV, hello.
Hello, this is Regina.
Yes, Regina, thanks for calling. Where are you calling from?
I'm calling from London.
Oh, nice hearing from you. Please bring in your question.
My question is about menstruation.
Pardon?
My question is about the hormones.
Okay.
Menstruation.
Okay.
I take like 3 months without getting my period.
Okay.
Then when I get them, they are so heavy and with clots, and they don't stop until I get tablets to stop them.
Okay.
Yeah.
Thank you so much, Regina, for calling. Doctor will respond to your question immediately. She's talking about...
Yes, she says it takes long to get her periods. When the periods come, they last for a longer time.
And they are heavy.
They are heavy, and she has to take medication to stop. Now, this condition, we call it menorrhagia. Menorrhagia is just heavy periods. That's a medical jargon, meaning heavy periods. And the pattern you have described is typical of certain conditions which we know in gynecology, and there may be what people call PCOS. But again, there are also other causes of this. So it's very, very important that you get it evaluated properly, because you need to do proper assessment by a gynecologist. They may need to do a scan to look at your ovaries, because things like PCOS are diagnosed by a scan, some special form of scan which they have to do. And
the
also
call
the
on the
hormones,
line, we shall be taking 2 calls, then doctor, you respond at the same. Yes, caller, Bethan TV, hello.
My name is Patrick.
Yes, Patrick, where are you calling from?
I'm calling. My daughter was born.
Your daughter?
At the week my daughter was born, at the week was the black. I think the menstruation. I wonder whether it will affect her eventually.
How old is she? Patrick, how old is she?
Now she's very young, but at first, which time she's not black.
Okay, thank you.
It's talking.
Thanks so much, Patrick, for the call.
Yep.
Another call on the line? Okay, thank you so much. Doctor, can you respond to Patrick?
Yes, Patrick has...
I take another call?
Yes,
sorry, doctor, there's another caller. Hello?
Yes, it's me, Regina.
Yes, Regina, welcome back.
Thank you.
Okay.
I wanted to tell the doctor that I was diagnosed, I saw the gynecologist, I was diagnosed with the PCOS.
Yes.
Okay.
Then I was put on tablets. But when I'm on tablets, my periods are normal. When I get off tablets, then the system goes back again.
Oh dear.
The other issue I told you, so I don't know what's wrong, because I can't be on top all my life.
Thank you. Thanks so much, Regina.
And I'm struggling to conceive.
Oh, sorry about that.
Yes, so I think, thank
you
you.
can start with Patrick, then you go to Regina.
Maybe I link up this one of Regina and so that to get some information complete.
Okay.
Yeah,
okay.
because the part of the explanation was before. Yeah. Yes, as I told you, I'd suspected that it could have been PCOS, as you've rightly said. Now, PCOS is a condition which has a number of managements, my number of ways in which you can manage. And so you start with one. If it doesn't work, you go to the next level like that until eventually your objectives are achieved. But it's manageable. Okay. So you should discuss with your doctor, and the doctors will be able to explain to you the different management options which are available.
Okay.
Some of them are tablets, but on your side you can also work on your weight. If your weight is a little bit high, it's very, very effective actually in managing PCOS. If you can lower your body weight by doing exercises, managing your diet, and also having a psychological stability. You know, some people gain weight when they have some stress. So
they're worried.
Yes.
Thinking over and over again.
Exactly. So if you can manage your weight in the meantime on your side by the right diet, by doing exercise, and then you discuss with your doctor the other modalities. Apart from medication, the other modalities for managing PCOS. But also the other thing I wanted to tell you is PCOS affects mainly ovulation. But there are other causes of failure to conceive when you have PCOS. Okay. You could have an additional problem like maybe a tube, you know, that also has to be...
When she's unaware.
Yeah, which you're not aware about. So that has to be evaluated so that you don't waste a lot of time. Your problems should be analyzed to the dot so that you know what the exact issues are, and the issue could also be with the man as well. You see, that does not stop the man from getting a problem if you have a problem. So you have to, you know, this is the sort of reasoning behind. You need to discuss this.
Thank you so much. Another call on the line. Hello, caller. Bulungi mama, wasibye otya eyo? Twogera n'ani oba? Mukyala Janet?
Josephine.
Mukyala Josephine, oli otya eyo? Ye maama, tukuwulidde. Buuza ekibuuzo, omusawo awulira. Ye maama.
Nina emyaka 28.
28?
Naye sifunangako kisho zange ng'omukyala kale.
n'amabere kifuba nkumi ajawo simanyi kigambo ki.
Sorry Mama Josephine. Kale mukwano. Omusawo ajja kwanukula. Thank you.
Yes, thank you. So I think before we respond to Josephine, there's this gentleman I really
Patrick.
want. Yes, Patrick. He brought a very important thing because I am very impressed because he's a man. He noticed it when the baby was born, that the baby had a period at the time of birth, and he's wondering what this is and whether this will culminate into a problem later in life. Yeah, this is very important, not only for him, but for many people. This happens in a number. So what he's describing is what we call menstruating baby syndrome.
Menstruating baby syndrome.
Yeah, now this is a normal thing. It's a syndrome, but it's a normal thing. So what happens is when the baby, a girl, is inside the mother's womb, the mother has high levels of hormones, estrogen and progesterone. These are supposed to support the pregnancy. They are produced by the placenta. Okay. They are to support the pregnancy. But now they go into the baby's blood. They spill over into the baby's blood. And you know this is a girl who has a womb, a uterus.
True.
Yes.
True.
So they will go and start causing the lining of the womb for the baby.
Basically, they collect somewhere in the baby's internal.
They go through the blood system, through the placenta into the baby's body, and from the baby's body down onto the womb, and cause the same effect that would have happened if the baby was having the same hormones. Now, at the time of birth, the baby is detached from the placenta.
Yes.
So that is a withdrawal of the hormone source. And it is similar to what happens to a woman and it brings periods. So it is the same mechanism, similar, but it's because the hormones which were coming from the mother are no longer getting to the baby at the time of birth. Okay. And the baby will have that bleeding for a few days.
It will
about
flow out.
3 days, and after that nothing.
Okay.
And it does not affect the baby in future.
Thank you so much.
So Patrick, don't get worried, your baby is okay, and it happens.
Thank you so much.
Yes.
Now to this lady, Josephine, she's 28 years old.
Yeah.
No breasts, no menstruation cycle, nothing. She's worried. What could be wrong with her?
She's 28.
28 years old.
Yeah, so yes, Josephine, you definitely need a thorough evaluation because, again, development, normal body development, like the secondary sexual characteristics like development of the breast, development of the hair, and changes in the shape are controlled by the hormones. And these hormones are regulated by the brain. And they must happen at a certain time. And in case it's not happening, like in her case, that is called delayed puberty, that has to be addressed. Definitely there's a problem there, and has to be. There are a number of problems which can show up like that. Some of them are genetic, some of them are hormonal problems related to the adrenal gland. Some of them are related to brain issues. So it's a myriad of issues. She needs to be evaluated definitely. I hope she's seeing, especially an endocrinologist. She must see either a gynae endocrinologist or an endocrinologist. If she can come over to us, we evaluate her.
At Bethany Hospital?
Yes, at Bethany Hospital. We're able to evaluate her in details and see how to help her.
Okay.
Yeah.
Thank you so much.
The advice I can give in relation to that to parents is that you should pay attention to the development of your child.
Especially when they are young.
Yeah, when they are young, because these milestones of development must be achieved.
Okay.
Sometimes if you are not sure, you should allow the doctors to evaluate.
Okay.
Yes, and also to the doctors, pediatricians. When a child comes for one reason, maybe like has fever or pneumonia, don't stop there. Look at their genitals as well. Are they well developed or what? Yes, even at birth.
Thank you. Thanks so much.
This must, and they are best managed at
when
that
they're still
stage.
young.
Yes, they are best managed there.
Thank you so much.
Yes.
We are running short of time, but this has been Medical Minds, and we are looking at basics of menstruation with Dr. Underbat from Bethany Health Center Hospital. The closest one near me is Entebbe side. We also have Bethany somewhere, I saw, another hospital. So please, in case you have more inquiries, you can reach out to Bethany Hospital and look for doctor. He can give you all these answers that you're looking for. I've been Teacher Zita, hosting you throughout the show with Doctor. For now, I and the team, we are signing out. Have a very good evening.
Thank you.
Bethany TV for health. Ladies and gentlemen,